Good afternoon, Giovanni.
Thank you so much.
How do you feel about being broadcasting live surgery next year for SEPa?
It's really a great honor. It's also a great responsibility, because life is life, and so you most of the time don't know what is going to happen. I have to tell you that I had also the experience of Europerio in the last Amsterdam meeting, and so I'm quite used to making live surgery. I think that live surgery can make the difference because people love it and because people can also understand which is the difficulties we have when we operate our patient, which is not exactly the same when you make lecturing. Probably we are going to treat recession in the lower incisors, which is an area that most probably is the most periodontal involved gingival recession lesion, so more than aesthetic indication. It can also be a periodontal lesion because in this area we have many anatomical conditions that make this gingival recession more probably, or let's say more at risk to have some periodontal implication like probing pocket depth, loss of bone because of the muscle spool, the very shallow vestibulum depth, and also because of the much more difficult for the patient to keep this area clean.
So what are the largest challenges that you have to deal with when you're doing live surgery and broadcasted live surgery?
I think that the most important thing is to know the patient and to have the right indication, because the patient has really a key role, especially when you make surgery in some areas which is quite difficult to manage, like the lower incisor. So you have to know that the patient is really very motivated, is patient that is calm, no systemic problems. So it's very important to prepare the patient, and I really appreciate SEPa that gives me the opportunity to prepare my own patient in my own clinic, so I have the whole comfort to try to do my best on my patient.
It's pleasant to be able to perform surgery with your own setting, with your own people that know exactly what you need, what you want, isn't it?
Yeah, especially the assistants also. We are used to working always with the same people in our clinics, and this is what should be done, because if it's live, it's really live. It doesn't mean that it's more difficult than what you do every single day. And so I think that live means that you make in your setting and you expose what you do every single day to the whole audience.
So what kind of professionals of the dental community would you recommend to attend this live surgery?
I think that we have obviously periodontists. We also have the orthodontists that will be very interested, because especially in the lower incisor, gingival recession has many things to do with orthodontic therapy. And so I think, and I really invite all people from the general dentist to orthodontist to periodontist, and obviously also to people who's going to make also implant therapy, in order to see how much we can do even in the most difficult situations, that is the lower incisors zone.
We are hoping and we look forward to this event. We are sure that there will be a great audience expecting, seeing how you perform live surgery, and we really look forward for that day.